Great morning, great afternoon, great evening. Hey, love. Hey, love. Hey, love. Think I forgot to say that in the previous video. I apologize. Hey, love. I am Jessie C. Love, also known as Teacher Love, Coach Love. This is the Love Your Health, Love Your Life, Love Yourself education and information segment that I do for the month of July, Monday, Wednesdays, and Fridays, 1:11 Pacific Standard Time. This is a recording because I have another appointment that I have to get to from physical well-being. Yes, indeed. Oh, wonderful Wednesday to you. Wisdom Wednesday time. Let's be wise. I appreciate that you decided to tune in and that you cared to share. Yeah, it may not be for you, but you don't know who you may impact and help. So thank you for helping me reach out. Those of you that are in the Sacramento area, let me say this right now. I will have to post it tonight, 5:30 to 8:30. There is a multicultural town hall discussion, open discussion and meeting to get mental health care and resources. Talk about it. We need your presence on 44th Street. I need it. Matter of fact, decided to go get it anyway. It's Pathways to a Healthy Mind Multicultural Town Hall, Conversations and a Call to Action. 4625 44th Street in Sacramento, 95820. Fruit Ridge Community Collaborative from 5:30 to 8:30 today, July 24th. There's a keynote speaker, Dr. Andres Ciola. He's going to be there. Refreshments will be provided. NAMI is sponsoring, part of the sponsor, but Sacramento County is the rest. I need you there. I'm a NAMI facilitator and co-facilitator, peer support, family to family trained facilitator. If we have the presence that I'm expecting, then what we want to do is to set up a group, family to family, to help families learn how to help their family and friends deal with a mental illness so we can talk about it and stop calling it crazy or stop ignoring it or thinking that we can pray it away. All right, I've agreed to help facilitate the group. I need you there though. If you don't want to come, send someone, but I need you there. Somebody to be there. It's tonight, 4625 44th Street in Sacramento, 95820. Yes, I will be there. You'll see me somewhere wearing this shirt because each mind does matter. Okay. I'm also a youth mental first aid responder with suicide prevention. So all of it is part of mental illness. Today, I wanted to talk about something that I've been hearing and I wanted to do a little bit of research on it. And because this is a recording, I did not write a lot of the information down. It's called dissociative identity disorder, and it was previously known as multiple personality disorder. It's thought to be very complex with its psychological conditions, and they say that it comes about basically with a lot of factors. Severe trauma in early childhood. That early childhood trauma can be sexual abuse, physical abuse, even emotional abuse. And what it ends up doing to someone who has dissociative identity disorder, also known as DID, it's a disassociation, a mental process which produces a lack of connections to one's thoughts, memories, feelings, actions, and even sense of identity. Dissociative identity disorder is thought to stem from that combination of trauma, that disorder. The aspect to be able to cope with it is really diminished because a person literally, they shut off. They disassociate themselves from the incident or the trauma, the violation, because it's too painful and they don't know how to deal with it. They don't have the coping mechanisms and the skills to actually process everything that happened. It was too violent. Yeah. Who's at risk? They say that it's very vague as to who's at risk, but it's interpersonal. It can be environmental, particularly those early childhood years when emotional neglect or abuse can interfere with personal development. As many as 99% of individuals with DID, they have personal stories of recurring trauma that has happened. Often it can be life-threatening, and it's sensitive, usually before the age of 6 that this happens, that they say. It can happen with persistent neglect or emotional abuse, even when there's no physical or sexual abuse. Findings that I read said that when parents are frightening and unpredictable, the child may become dissociative. DID affects about 1% of the population. Yeah, about 1 in 5 adults have a diagnosed mental illness, those that actually go and get the help. Is characterized by the presence of 2 or more distinct and split personalities or identities, where those personalities or identities have a clear influence over the person's behavior. And that person can possibly not be able to recall what actually happened. With dissociative identity disorder, there's also highly distinct memory variations, and that can fluctuate with the split personality that may happen. It can alter between the person identifying even with their own gender, their age, their ethnicity. Each has his or her own postures and gestures and ways of talking or thinking and acting. And sometimes people that have DID can even become animals or begin to act like animals, the behaviors of animals. They call it switching, just like personality disorder that I did on Monday. Switching can be for seconds, it can be for minutes, it can even be for days. When under hypnosis, the person's different alters or identities can actually be responsive to like therapy. So the therapist ends up getting to meet who that alternative identity or person is. Some of the symptoms that they say come with dissociative identity disorder include headache, time loss, trances, nausea, out of the body experiences, self-persecution, self-sabotage, maybe even self-inflicted harm, violence to self. An example would include speeding, reckless driving, stealing money from a friend or employer, and they feel they're being compelled to do it. Like they don't want to, but they're being compelled to do it. Like they're in a different body. They're not the ones that's driving. Someone else is. And they could possibly feel like they have no choice. Depersonalization. This is a sense of being detached from one's body, the out-of-body experience. Derealization is a feeling that the world is not real, or it looks foggy, or it's far away. Amnesia, failure to recall any kind of situation, conversation, something that's not remembered from 1 second to the next. Identity confusion or identity alteration. Both of those involve not even knowing who you really or who they really are as a person. That can be trouble defining things that interest in life, that's interesting in life, political or religious or social viewpoints, sexual orientation, or professional ambitions. These kind of alterations can occur in distortions in time, place, and situation. They say there's usually a host personality within the individual that also identifies with the same real name. And ironically, the host person is not usually aware of the other personalities that are there. How is it diagnosed? It takes time to diagnose it. Sometimes those who have DID have spent like 7 years before they're actually diagnosed with a mental health professional in order to get an accurate diagnosis. Treatment is sought in the same way a lot of other mental illnesses are sought, psychiatrically. And many people have this that have this dissociative disorder also have dual diagnoses. There's something else that's coexisting. Could be depression and anxiety that's also in it, as well as personality disorder. The DSM-5 that provides a criteria for the DID, the dissociative. They say you have to have 2 or more distinct identities or personalities present that include a pattern of perceiving, relating, and thinking about the environment that it's in. Amnesia can occur with different gaps based on traumatic events. Be in distress by the disorder, trouble functioning, disturbances, especially when it comes to normal parts of daily functioning or religious practices, cultural practices. Sometimes the symptoms can be the direct effect of substance abuse, such as alcohol. Yeah. You may have blackouts or chaotic behavior, they say, the possibility of that occurring. And someone who has DID, they say that there's an average of 2 to 4 different personalities that can happen. There's an average of 13 to 15 personalities that can become known over the course of treatment. There are some people who even experience 100 personalities, more than 100 personalities. Environmental triggers, they say, or life events cause a sudden shift in one personality to the other. Psychiatric symptoms that may also come. Ooh, this is deep. Include depression, somebody's calling. I have no idea if it's blocking me or not. Some psychiatric problems include symptoms that could be depression, mood swings, suicidal tendencies, sleep disorders such as night terrors, insomnia, sleepwalking even, anxiety or panic attacks, phobias, flashbacks, reaction to the stimuli or triggers, alcohol and drug abuse, compulsions, even eating disorders and hallucinations. So like if you were watching when I did the schizophrenia demonstration, where I was giving you directions, but I had a couple of different voices going on at the same time, and you had to try to listen to mine. The one that I did when it comes to making a phone call to, say, the police, and when the police come and they start shouting commands, someone who has one of these more severe mental illnesses doesn't know which voice to listen to. So consider somebody that has dissociative identity disorder or DID, or what was known as multiple personality disorder, and the possibility of having 2 to 4 different personalities within, or someone who may have 100 different personalities within, and then somebody else comes giving them directions and instructions, and it's possibly in an authoritarian manner. They don't know who to listen to. Famous people with dissociative identity disorder, and it would be great to see these people when you look up DID. Herschel Walker, the NFL player. How many knew that? How many knew Herschel Walker had multiple personality disorder, which is now called dissociative identity disorder? Lady Gaga. Roseanne Barr. Adam Duritz. Yeah. Herschel Walker, by the way, he wrote a book in reference to his DID. explaining how he had feelings of disconnection from his childhood all the way to the NFL. He said he developed a tough personality in order to deal with it. That way, he didn't have to deal with the loneliness and the fearlessness. He wanted to act out in anger, but he suppressed it. And then you got to think about NFL. I can hit somebody. He said those altars would withstand the abuse that he felt, and then they came out to help him rise in the NFL. Wow. He is doing treatment for the dissociative identity disorder. He didn't get his diagnosis until he was in his adulthood. Yeah. They say there's no cure for DID. Long-term treatment and effective treatments such as talk therapy, group therapy, knowing what your triggers are, knowing what the fuses are, hypnotherapy they use, adjunctive therapy, which means that can be movement therapy to help cope with the trauma. Speaking about what's going on, because the symptoms of DID often occur with other disorders such as anxiety and depression, some people utilize medicine, and it's prescribed medicine and psychotherapy. I say, do what needs to be done for you. Because, I didn't know Herschel Walker had DID before I started doing research. Mental illness is not always what we think or what society portrays. And I'm one that can admit that because I have anger. I just experience anger. I experience grief, which was added recently, and I deal with those by going to grief groups, especially if I feel if I'm too low, because it's all a roller coaster. I experience depression. Oh my goodness. Like how I'm getting clean bills of health from all these tests that I'm doing, including the scan that I just had, which I'm kind of feeling like, you know what, this may be getting me prepared for that marriage license. When they say you got to do all this blood work to show anything, well, all mine is beautiful. There is a little cyst, possibly in a lung. Let me see, where was that? No, there's a little cyst in a kidney. But it ain't the kidney side that's hurting. Know what I'm saying? There's no fluid around my heart, no fluid in my lungs. My pancreas is, all this. Two pages. I'm so grateful. There's no bowel obstruction. There's none of that. My blood is clear. Everything. Fibroids are there, yes. But this pain ain't from no darn fibroids. So that's why I'm on my way to do another test. I'm like, this is starting to affect me mentally. It's causing grief. And there's a little bit of sadness going on. And I'm going to claim now that I'm not going to have PTSD from all of this. I refuse. I won't. This is not traumatic. It's all for a purpose. It's just that when you don't know, but you can feel something wrong and everything you're doing, it can get to me. Thankfully, it hasn't. I'm protecting myself as best as I possibly can. But I do know if I don't, depression can come. Yeah, it can. Grief can come, as well as anger can come. Because I'm just like, this ain't making no sense. But I'm so grateful that I have copies of everything that we're doing. Yeah. So, DID was the topic today. Dissociative identity disorder, which was once called multiple personality disorder. I appreciate your time. I appreciate those of you who share. I appreciate those of you who speak about it, because it may not be for you, but somebody may need to hear about this. Recovery is possible. When we share our stories, everyone else realizes that they're not alone and it's okay to talk about it because we help one another when we talk about it. All right? Remember that the first wealth is your health. Take care of yourself. Don't self-diagnose. Don't self-medicate. Reach out because support is there. It's possible. And recovery is possible. Whew, I appreciate your time. Thank you for tuning in. This is the Love Your Health, Love Your Life, Love Yourself Education and Information segment for the month of July, which is known as National Minority Mental Health Awareness Month, mental health or mental illness. I'm doing these on Monday, Wednesdays, and Fridays, 1:11 p.m. Pacific Standard Time, unless I have to record it like I did today because I'm going to be in an appointment taking care of me. So we have 3 left, and then I'm going on a sabbatical for just a little while. Until next time, and as always, love you.